Section 6. Internal Relationships and Practices. Most organisations that run meeting centres have governance boards made up of individuals from diverse backgrounds who oversee things. These individuals, often called trustees, can be crucial to a meeting centre's ability to sustain. Ideally, trustees will include people living with dementia and people who support them. They'll have a range of skills, experience and connections between them that they can use to support the meeting centre. These might include experience of running an organisation, managing finances, or contacts in the care pathway. If there are gaps in their collective experience, there are not enough trustees, or they don't have the time or capacity to apply their skills, then a centre may struggle. We have the following recommendations. We suggest meeting centres try to ensure the skills and experience of individuals on any governance board cover the full range necessary to support the functioning and sustainability of the meeting centre. Responsibility for different aspects of the meeting centre can then be distributed between board members. Where there are gaps, seek new board members. Ensure the members of any trustee or governance board have the time and capacity to apply their skills and experience. Having skilled, motivated individuals with the right ethos and approach to run meeting centres is key to their quality and sustainability, whether that's managers, staff, volunteers or trustees. The meeting centres run in a challenging landscape. Without key, highly driven individuals consistently putting in time and hard work, they'd often not get started at all, nor continue to run. Meeting centres often rely on the skills of one or two individuals to manage them day to day as well. This reliance on key individuals is a strength and a weakness. As long as those individuals are with the meeting centre and have capacity, it boosts their chances of sustaining. But if they leave or become exhausted from the pressure, the centre may be in trouble. Running a centre primarily with volunteers is possible but risky. While it may seem more sustainable as staffing costs are low, it may be difficult to find volunteers willing to take on such responsibility, and it will be hard to guarantee skills and experience, and unfair to demand long-term commitment from them. Recruiting and keeping skilled and experienced staff can be a problem if there is no long-term job security. Larger organisations could potentially offer better job prospects. They may also have a wider reach in finding staff and volunteers and more flexibility in deploying them. It's not just members who may have travel challenges getting to a meeting centre. Staff and volunteers may do too. When an organisation is running multiple centres, sharing staff and volunteers between sites may seem an obvious way to work efficiently. However, this may not always be possible due to the travel involved, which can be an issue both in rural and in urban areas. Volunteers can come from various backgrounds but often have experience of working in health and social care or caring for a family member or friend. Carers of existing or previous members often go on to volunteer. People living with dementia with milder symptoms may also take on a volunteering role with some support. Whatever their background, it's important that volunteers feel welcome and valued if you want to retain them. We have the following recommendations. We suggest meeting centres seek highly motivated people to drive your meeting centre, but ensure responsibilities are spread between personnel and do not all fall upon one person. If possible, employ skilled and experienced staff to run your centre, but be clear about job security. Consider partnering with a larger outside organisation that may be able to help with staffing and job security. If running multiple centres, consider sharing staff and volunteers between sites, but check with them that this will be possible. Do not overburden volunteers with responsibilities and workload. Try to create a friendly, flexible working environment for them where they feel valued and rewarded for their time. If appropriate, suggest to family carers, ex-carers and people living with dementia who are active and willing that they could consider a volunteering role. Seek volunteers who have a background in supporting people with dementia or other care needs. If you are considering attending a meeting centre, consider whether you might like to take on a volunteering role. You can discuss this with the meeting centre manager. A person-centred ethos is at the heart of meeting centres. Person-centredness is central to a high-quality experience that meets the needs of everyone. In order to deliver high-quality person-centred practice, meeting centres, their staff and volunteers need to have the capacity to do so. A lack of flexibility, staff time or consultation with members can mean provision is not as person-centred as it could be. We have the following recommendations. We suggest meeting centres remember to consult with all members on what they would like to do and how you can meet their needs. Consultation is key to planning and delivering sessions. Allow for a high degree of flexibility regarding the activities and plans for any given day. This means that changes can then be made in response to people's needs and preferences in the moment. If you go to a meeting centre, let staff and volunteers know what you'd prefer to do or not do. Feel free to make suggestions for future activities. Meeting centres have a clear ethos, purpose and place in the dementia support pathway. That's to help people living with mild to moderate dementia and their families to adjust to change together. This is achieved via a social model of support that can connect people with their communities while delivering stimulating and meaningful activities in a person-centred way. However, there are various pressures that may drive meeting centres to veer away from one or more of these elements. Some areas of the health and social care system around meeting centres have different priorities and therefore might encourage something different to what meeting centres are designed to offer. For example, daycare-style respite provision for people with more advanced dementia. This can lead to unwanted or unintentional mission drift. Mission drift can also result from a lack of training and different agendas in staff and volunteers. We have the following recommendations. We suggest meeting centres ensure that they are run as intended according to the essential features of a meeting centre booklet. Stay vigilant to unintended or undesired mission drift. It's important for staff and volunteers to have meeting centre training. This helps them to understand the purpose and ethos of meeting centres and ensure the quality and consistency of delivery. We suggest potential commissioners or funders of meeting centres ensure the meeting centre offer and how it differs from other forms of dementia support is clearly understood. Then you can decide if this fits with your funding aims and objectives without having to change the meeting centre model. We suggest health and social care professionals ensure that the meeting centre offer is clearly understood so that referrals and the expectations of your patients and service users are appropriate. You can also watch our videos on referrals and pathway, reaching people and membership, and carer benefit and engagement. This independent research was funded by the National Institute for Health and Care Research, or NIHR, under its Research for Patient Benefit, Research for Social Care programme. Grant reference number NIHR 201861. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. We would like to acknowledge and thank all meeting centre attendees, personnel and partners that participated in this study, as well as our research collaborators at the Three Nations Working Group on Dementia, Nuffield Department of Primary Healthcare Sciences at the University of Oxford, London School of Economics and Political Science, and Worcestershire County Council.